Let's talk running on BBC Radio Nottingham because it's the one thing that's helped so many people get through lockdown, isn't it? Turning to running. And there's a major study now in Nottingham which is aiming to find out just how important running actually is, mentally and physically. Dr Joe Stocks is Assistant Professor in Sports and Exercise Medicine at the University of Nottingham. Afternoon, Joe.
Hello. Afternoon.
Hello. So where did you get the idea for doing this then?
Well, my colleague, Dr Stefan Klusek, and myself have had the idea of looking at running and injuries before the pandemic. So we want to track how people exercise, their training regime, and then subsequent injuries and illness, and then how they recover. So this was already planned before COVID. And then when the pandemic came about, everyone's running was impacted, so in positive and negative ways. So, for example, some people had more time on their hands and so took up running. Other people had homeschooling and work commitments and then weren't able to run as much. And we wanted to look at this and see whether we could look at the changes and see whether we were able to help people's mental health or physical health or even recovery from COVID due to running.
I see. I'm in the latter category there. So I used to run once or twice a week. Now I haven't run at all since COVID started, just because, as you say, there are lots of commitments at home, and I'm pretty much full-time carer at home where my wife's at work, and I'm not at work myself. And there just seems so much less time to do stuff. Because I suppose for me, the time I used to go running was in my break at work, and then suddenly breaks at work went out of the window, and when you'd finish your show, you were expected to leave, so you couldn't be a COVID risk. And I just, at home, never really have time. So how will you measure the impact that running has on somebody's physical and mental well-being?
Well, lots of runners nowadays have smart watches or fitness watches that they're tracking their data all the time. So we want people to share this data with us. So it's not actually a lot of work that they have to do. Lots of people have Strava accounts, or they, for example, have a Garmin watch. And we've partnered with Strava and Garmin, and they can link up and allow them to share their training data with us. And we have a short survey that we would like people to complete, saying what their health status is at the moment, and then to just let us know if they got an injury, an illness, or, for example, we've got COVID or we're isolating. And we'll be able to compare data from people that are training and to look at their subsequent health status.
What's your personal view of this? Do you believe there is a benefit?
Well, that's what we want to look into, because obviously no one's looked at this before.
You must. Do you run yourself, Joe?
I do, but like yourself, I've cut down a lot since COVID. So I used to. I live in Arnold and I work at QMC. It's 6 miles each way, and I commuted to work by running, and I don't have that anymore. So I've kind of cut down those 12 miles a day just in commuting, and I really miss that.
Yeah,
but then I don't have as much time to do it. But I like doing running marathons. I've done over 45 marathons.
Oh, so my goodness me! See, I thought I was a runner. I'm nothing compared to you. So why do you do it? Tell me what do you get out of running?
I do actually like it as a way to commute. I don't drive, so that's how I get from A to B. But I do enjoy it. I love, and this is what also that we want to look at. I miss going out into the countryside, going to running Bestwood Country Park. I don't want to go running there and see past somebody very close on a narrow path. So I've just avoided running on the trails, and I'm a member of Red Hill Road Runners in Arnold, and we often go up to the Peak District and do fell running, cross country, and all these we haven't been able to do for the last year. So instead of running on soft grass, we're now having to run on treadmills and roads, and the terrains that we're running on are possibly impacting our joints, and this is another thing that we want to look at.
Okay. Well, it's all lots of research to be done. How can people take part if they want to?
So, simple thing to do. Most people have got smartphones now. And even though they don't realise it, they're being tracked every time they go for a walk. So there's an app called Strava, which you can download. And every time you go for a walk, so we're not looking for runners, we want all level of physical activity in the community. So whether you were an established marathon runner who has now had COVID, and maybe you're suffering from long COVID and you're not actually running at the moment, but you hopefully want to get there, we want you in the study. We also want people who have never run before and think, actually, I want to get out and do a bit of exercise. I know that losing weight will help, or I've seen that it can help with COVID symptoms, and they want to get out there. And at the moment, they're just going for a walk around the block. We want you as well. So we want all levels of people to take part. Sign up to runningthrough.org and share your data with us, and everyone can help us.
Excellent. Well, enjoy the research and maybe enjoy running again one day, Jo.
Yes.
Thank you. It's BBC Radio Nottingham. It is 4:30.